Curved blades are really important to use in procedures with tight spaces. Even with the knee, we do have a fair amount of space, but to get to the back of the knee around the condyle, curved blades are made for those areas.
So you can creep under the convexity of the medial-femoral condyle, and then also the convexity of the undersurface of the patella. Helps you get from one side to the other without necessarily having to change portals.
Also, you can use them in hips, again, trying to get around the curvature of the femoral head, especially in tight spaces around hip. They're also useful too.
I have not been a huge curved blade user to date, and probably some of that has to do with the fact that I've not always felt that the curved blades give me as clean of cut.
A lot of the challenges with the current curved blades due to some of the resection quality and also some of the clogging. So sometimes you can get clogging within the bend of the curve, especially on higher resections that you do, that can slow the case down. So it can be dissatisfying to use some of the curved blades. The two blades, in terms of the curved, are going to be what's called the synovator and also the curved incisor. The curved incisor has cutting edges on the outside of the blade, so it's going to be a little bit more aggressive. I think you can use that more in resecting fat pad. You can also maybe use it to resect more tissue closer to the bone where you're not worried really about some of the surrounding edges. The synovator, I really like it when you're going around like a condyle. There's no cutting edges or sharp blades around the sides of it, so you're less likely to scuff the edges of the cartilage. They both function great. I think they both do their resection, and they have great smooth edges, even with the incisor. Platinum blades help to improve a surgeon's practice by three ways. Number one, they have a very smooth, efficient resection. The tolerance between the inner and outer tubes are very tight, so it's a very, very sharp resection, which again leads to smoother edges. And we also worry about wear debris. So wear debris is a big deal, especially on longer cases or when you're doing a harder debridement. And the shedding that we worry about are small metal particles. And I believe that the platinum actually reduces that to almost completely zero. And the third, I think, is going to be less clogging. They have a ceruleum coating on the blade, which theoretically reduces the friction. And again, that also leads to less clogging between the curved portion of the blade.
I think the cut is a little cleaner. It's more and appropriately aggressive. If you've been disappointed with the way curved blades perform in the past, give this new one a try.
Smith & Nephew's Platinum Bone Cutting Shaver has become my go-to instrument for a number of clinical scenarios, including preparing the intercondylar notch for an ACL reconstruction, for subacromial decompressions and distal clavicle excisions, for preparing the anterior and posterior aspects of the glenoid for labral repair, and the greater tuberosity for a rotator cuff repair. Pretty much any situation where an arthroscopic burr was previously used, I'm employing the Platinum Bone Cutting Shaver for a number of important reasons. The major benefit of the Platinum Bone Cutter is its ability to sharply resect bones secondary to the quality of their blades, and manage soft tissue all in one instrument. Couple this with the fact that it doesn't produce the typical debris snowstorm seen with an arthroscopic burr, with the fact that it rarely ever clogs or forms metal debris within the joint, and you're looking at improved effectiveness and efficiency for knee and shoulder arthroscopic procedures. In summary, I believe that Smith & Nephew's Platinum Bone Cutter is a major technological improvement for any clinical scenario where an arthroscopic burr was previously used. As you can see in the examples provided, the Platinum Bone Cutter is a very easy to use instrument capable of managing both bone and soft tissue. Secondary to the quality of the blade's new fortified alloy, bony resection is sharp and precise. For subacromial decompressions and distal clavicle excisions, the Platinum Bone Cutter has the benefit of not creating the debris snowstorm that is typically seen when using an arthroscopic burr. In my experience, the Platinum Bone Cutter rarely ever clogs or generates metal shedding within the joint space. Overall, I believe that the Platinum Bone Cutter makes for improved effectiveness and efficiency for many knee and shoulder arthroscopic procedures. Thank you very much.
With the use of the pink hip kit, it prevents the patient from sliding and we can achieve distraction. After the hip is then out to distraction to an adequate length, which is approximately 10 to 12 millimeters, you can then perform your surgery and there are no other changes to your technique that are required. And that is great because the cost of transitioning to a new bed or a new technique potentially is large. And with the use of our pad, you can keep your bed, you can keep the actual traction device without any significant changes to your routine and your practice. We've always tried to improve upon is the safety of the procedure. In addition to the efficacy, we want to make sure that we reduce the risk of any kind of complication around the time of a surgical procedure for our patients. One of the big complications associated with the first technique that we used with hip arthroscopy was the use of a perennial post, and that post has been associated with many different kinds of complications that's always prompted a look into potentially a safer way to perform the procedure. One of the complications that is significant that patients have read about or heard about is the potential numbness to the perineum, numbness to the genitalia, numbness to the inner thigh. And that is something that if patients don't bring up, I like to bring up, because if something like that would happen, that is a very big deal to the patient and to their family and to their physical therapy recovery after surgery. And the nice thing with our postless system is that it truly does prevent that complication. Hip arthroscopy typically takes about 1.5 to 2 hours to perform the labral repair and the impingement correction. When you use a post between the legs, what can happen is there's a large amount of pressure applied to the perineum, the genitalia, and the inner thigh. And that can be associated with skin injury and with nerve injury, and this can happen in some studies as high as 30 to 35%. And this is something that if you could eliminate that post, then you can actually reduce that complication to the perineum down to 0. So I've now performed hip arthroscopy on a few patients in which we've done one of their hips with a post and their other hip without the post. And the way this originally came up was there was a patient in which we did her right side with the post 2 years ago, and then we had just done her left side approximately 3 months ago. And one of the first things that she told me when she came in for her initial post-operative appointment was that, "Did you do something different?" And she didn't even let me say, "Hi, how you doing?" Her question was, "What did you do different this time that you didn't do the time before?" And the first thing that I said was that we use this new system that's called a postless system, in which we didn't use the post. And she said, "My pain was 0. I took 0 narcotic pain pills after surgery. I felt better. I had less pain on my thigh, less pain in my perineum, and this overall recovery for the first 2 weeks was dramatically better. And then after that patient encounter, the next 4 patients that I'd actually operated on, in which they'd had one side done with the post and one side done without the post, I asked them that question. And now this is certainly a small case series of 5 patients, but all of them have universally said that their overall early recovery was easier, with less pain. They were able to recover and get to therapy a little bit better, and there was a 0% incidence of any numbness or skin problems in their perineum, in their inner thigh. And so this is something that comparative single patient case study, in which we're looking at a post in one side and postless in the other side, has shown that there is less pain, better early recovery. And we really want to try to get patients off of pain medications and any kind of opioid dependency within the first 1 to 2 weeks. And that's something that if you can reduce that early pain by using the PINK hip kit, then that is one of the biggest advances that we have in our hip preservation techniques, because we can make our surgery safer and make our surgery better.